Most people don't get sick suddenly. They get sick quietly in 10 to 20 years. What if AI can spot those problems even before symptoms actually occur? Heart disease, diabetes, and cancer don't start at 65. They actually start early in your 30s and your 40s. The problem is most people actually don't know what to screen for, when to screen, and what actually matters. That's where AI becomes powerful, not as a doctor's replacement, but as actually as a guide. AI is very good at three things: organizing massive guidelines, personalizing risk based on age and sex, flagging things humans overlook. Instead of actually Googling 20 different recommendations, AI can actually summarize this into a specific checklist. Let me show you how that looks like for a healthy 45-year-old. At 45, preventive care shifts from labs to early detection. Annual blood pressure and weight, cholesterol every 5 years, diabetes screening every 3 years, colon cancer screening starting now, mental health and sleep screening, and then cancer screening based on sex. AI helps you connect the dots, like realizing elevated blood sugar plus belly fat plus high triglyceride equals future diabetes risk. The biggest advantage of AI isn't answers, but better questions. Instead of asking your doctor, "Am I healthy?" "Do I need a colonoscopy or a fit test?" "Is my cholesterol pattern dangerous?" "Should I start screening earlier based on my family history?" "What red flags should I watch for?" That's how AI makes your visit more effective. So let's dive in. I'll show you what prompt I actually utilized and placed in the AI algorithm to help guide me what screening I actually need for patients who are going to be 45 and older who are otherwise healthy. So we're thinking about someone who's asymptomatic or those who haven't seen any doctors yet. Do I need to see a doctor? When do I need? And what procedure should I actually utilize? So let's go ahead. As a physician, can you create a scheduled screening and interval from laboratories, testing, imaging, and procedures for an otherwise normal 45-year-old male and female for preventive care? Show interval testing, checkup schedule, and findings to watch out for. And this is what it actually showed. It actually showed a practical guide of core preventive principles starting the age of 45. It focuses from risk identification to early identification. Cancer screening becomes central. Metabolic, cardiovascular, and mental health risk rise. Interval depends on results, not age, which is very important. So, annual visits. What do we need to see or watch out for when we're actually seeing our physician? And this is going to be for both sexes. For annual visits, it's going to be a blood pressure, weight, BMI, and waist circumference. There's going to be a depression screening. They're going to be asking us about tobacco use, alcohol, or substance abuse, and counseling with regards to diet and physical activity. There's also going to be skin examination, which is very important to catch early moles which may resemble cancer, and early detection is very important. Also vision screening and dental exam. So what laboratories are going to be ordered? And so this just serves as a guide. It's going to be for fasting lipid panel every 5 years, every 1 to 3 years if abnormal, starting at the age of 20. So it's actually interesting. We are 20 years behind if you're starting at 40. Red flags are going to be LDL greater than 160 and triglycerides greater than 150. Next is going to be an A1C or fasting blood sugar. And this is going to be done every 3 years, starting at the age of 35. CMP, which includes your metabolic panels and electrolytes, every 1 to 3 years, starting at the age of 40. And what people are looking for are going to be signs of hepatic injury, which one factor is going to be non-alcoholic steatohepatitis, or CKD. And lastly is going to be TSH. It's going to be done once between 40 to 50, just for screening for hypo or hyperthyroidism. For infectious disease screening, the important things are going to be HIV, Hep C, hepatitis B, and STI screening. And this is done universally, especially for healthcare workers, but it also is going to be based on risk factors and exposure. Next one, cancer screening. And this is very important. Colonoscopy starts at the age of 45, and it is done every 10 years, meaning if you had a normal colonoscopy with no polyps. Once you have anything that's abnormal, that actually changes in interval, and it may be next 3 years or 5 years, depending on what pathology they find. The FIT screening is only performed annually if colonoscopy is declined or if you've had a colonoscopy previously showing that you have actually been cleared. There's also the Cologuard, and this is for average risk, and this is done every 3 years. So this is a genetic screening using your stool to look for markers for cancer. What to watch out for? Iron deficiency anemia, changes in bowel habits, and weight loss, which is actually very good as a recommendation. Now we're going to separate it for sex. For males, PSA is very important, and it is done every 1 to 2 years. The normal PSA velocity is going to be greater than 0.75 per year, LU2S. Female specific is cervical cancer screening, which is they test for HPV alone every 5 years, or a PAP plus HPV every 5 years as well, or PAP alone every 3 years. These are started earlier and continued until 65. For breast cancer, screening actually starts at the age of 40, and the interval is every 1 to 2 years based on findings. Cardiovascular risk stratification include ASCVD risk calculation, which is done annually, and drives statin decision. EKG once baseline, and it's optional if hypertension or with symptoms. Coronary calcium score, it's also done, which is done once and is optional if statin decision is unclear. Now we actually have musculoskeletal and bone health, utilizing vitamin D if you're at risk, or DEXA, which is not routine, but is done earlier for those people, again, who are at risk, those who have steroid use or hypogonadism. It even talks about immunization. So what are the vaccines that are going to be needed? Influenza, which is done annually. COVID boosters, that's going to be per CDC guidelines. Tdap, which is done every 10 years. And shingles, starting at the age of 50. And pneumococcal if you're at risk. Other important screenings include sleep apnea, if with symptoms like snoring or hypertension, hearing every 2 to 3 years, earlier if there is exposure, such as people who are in construction, osteoporosis risk, annual assessment, especially in women, and sexual health, annual for erectile dysfunction or libido changes. So findings that should trigger escalation. Number 1, an elevated LDL, which is greater than 190, consideration for statins, going to be evaluated by your doctor. An A1C greater than 6.5 will prompt a diabetic workup. ALT that is persistently elevated may be concerning for a fatty liver changes. A PSA that is rapidly rising may require urology referral to screen for prostate cancer. Iron deficiency anemia would prompt a colonoscopy regardless of interval, just to ensure that you don't have any tumor that is causing this bleed. Unintentional weight loss, malignancy workup is also going to be triggered. So here's a quick summary timeline from the age of 45, and it actually provides you with what you do every year, every 1 to 3 years, every 5, and every 10. Also has separation for women and men for those specific screenings. There you go. So Utilizing that prompt will provide you with information that will guide you. It does not replace your doctor. This empowers patients to take responsibility for their health, not only from your doctor's standpoint, but being aware of the things you need and understanding better what your doctors are looking for may actually help us take better care of you. With early detection, early screening, you may be part of your care so that we are not going to be late in catching disease processes. AI helps you realize when I feel fine is actually irrelevant. If you're in your 40s, your health future is being written right now. AI won't save you, but awareness will. If this helped you think differently about preventive care, please click the like and subscribe and share this with someone who you think they're too young to worry. And if you want a step-by-step guide on how doctors actually use AI, that's what's coming up next.